Hello, this is Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Today is the very last day of 2021, and I just want to use this opportunity to thank my audience for sticking with me since I started this YouTube channel on keeping it real and open clinic with Dr. Chudi. Now, to wrap up 2021, I want us to talk about a very important concept, a very important concept in starting your family. So I want us to talk about blood grouping. What's the role of the blood group as it relates to the woman and the man in a relationship when it comes to starting your family? What can go wrong in regards to your own unique blood group? Why do you need to know your blood group in regards to your partner? So you see, blood group are unique characteristic, which is actually seen in the red blood cells. So there are some specific blood groups anyone can have. So you can either have A, B, AB, and O. Now there are different classifications of blood group, but we are going to focus more on the rhesus factor. So a woman is supposed to have either A positive or A negative, B positive or B negative, AB positive or AB negative, or O positive or O negative. Now, the problem starts when the woman is negative. So when she's A negative, B negative, AB negative, or O negative, and her own partner, the male partner, is positive, this is where the problem starts. This is exactly where we need to be more careful. So before you take that relationship to the next level, before you say I do, before you begin to make love to bring forth babies, please, it's important you know your blood group. Find a reputable lab. Make sure they give you your own unique blood group. So I expect you to know if your blood group is A positive, A negative, B positive, B negative, AB positive, AB negative, O positive, O negative. You have to know this as a woman. Now, if you happen to have A negative, B negative, AB negative, or O negative, now you need to be careful in regards to choosing your spouse. Thankfully, when we talked about the incompatibility, it's not much more complex compared to the problems we can have in genotype. So what you need to do if you're in a relationship and you're negative, but your partner is positive, is to be aware of what you should do when you're planning to start your family. Because when you begin to meet with a man that is positive, that positive blood in the man will see your own negative blood as an enemy. So the first pregnancy you're going to have will pretty much be okay. Now, remember that your first pregnancy, you can abort it, you can have miscarriage, you can have stillbirth, or there can be a couple of things which might not actually lead to a live baby. But once you have been pregnant, and the possibility you might not know the blood group of your first sexual partner that got you pregnant is very high, because some people might be pregnant when they were doing boy and girlfriend relationship, and they would have removed that particular pregnancy. They would have had miscarriage, they would have had abortion, they would have had so many things done to them. They would have even actually had some trauma or road traffic accident. So once you have been pregnant and there is a communication between a likelihood of the positive baby you have inside of you and your own negative blood, that's where the problem will start. So your negative blood will be seen as an enemy. So the baby you're carrying on the inside for the first time and from your partner, they will start building what we call antibodies. So those antibodies are going to spare the first baby, the first pregnancy. So normally in rhesus incompatibility, we won't have any problem with the first pregnancy. So whether you had a baby, whether you had miscarriage, or whether you had stillbirth, the first pregnancy will be spared. But subsequent pregnancies, your body is now seen as an enemy. So that baby you had, which is positive, has already built what we call antibodies that will attack subsequent pregnancies. So this is where you need to be careful. So please ask your partner plainly. If your partner is positive and you're negative, we need to be aware. We need to tell our partner, we need to tell our doctor so we can plan ahead to give you the RhoGAM injection. Thankfully, the RhoGAM injection is actually supposed to forestall and prevent the adverse effect of breast incompatibility. So there are several scenarios you have to take the RhoGAM injection. Now, if you are negative and your partner is negative, no problem. If your partner is negative but you're positive, no problem. The problem is when you are negative and your partner is positive. So we don't really concern ourselves with what the man is. The man can be negative, the man can be positive. We are okay with that. But we begin to have concerns medically if the woman is negative. So you have to be conversant with the scenario. You have to make sure you go to a reputable lab, and you have to make sure that the result they give you is actually the original result. It's not a false positive. It's not a false negative. If they tell you you're negative, you are actually negative. Because we've had scenarios when they will tell someone that the blood group is this. Then over time, if they go to developed countries, they will discover that that result is actually not the true result. So please be careful. When you are checking your blood group, also check your genotype. Your genotype is actually much more important because assuming your genotype is AS and your partner is AS, the possibility that you guys will have a sickle cell child is very high because every pregnancy has a 25% chance of producing a sickle cell child. So you can completely avoid this by making sure that your partner is AA. If you're AS or AC or SS or CC, then you have to make sure that your partner is AA so your partner can dilute your sickle cell trait. Very, very important. So there are a couple of scenarios which I'm going to mention which will warrant you to take your RhoGAM injection. So I'm going to mention them. So I just want you to pay attention to them. Very, very important. Now, the first one, at about 26 weeks to 28 weeks of pregnancy, this is about the time the placenta can start to thin down. And this is the time there will be likelihood that the blood from the mother will mix up with blood from the baby. So in the first pregnancy and subsequent pregnancies, every woman that is rhesus negative must take the RhoGAM injection about 26 to 28 weeks. This is a must. You cannot avoid not taking this. Now, if you have had abortion, stillbirth, miscarriage, ectopic pregnancy in the past, subsequent pregnancies must be protected with what? RhoGAM. So if you had abortion, stillbirth, miscarriage, within that same pregnancies, we have to give you RhoGAM to make sure that you prevent the likelihood of your subsequent pregnancies being affected. Now, if you are negative, which I expect you to know, within 72 hours of delivery of your baby, especially if you're going through CS, and if the baby is positive, you are supposed to take another shot of RhoGAM. So remember, 26 to 28 weeks in your pregnancy, then 72 hours after delivery. Now, in some cases, in some pregnancies, we might have a need to collect cells and test from the baby inside your womb. So we can go for some invasive procedures like amniocentesis. In case of amniocentesis, we examine the fluid. So we go in and collect the fluid inside your pregnant belly. In other situations, we might go for what we call chorionic villus sample. We also go in and collect some samples to check for some genetic problems. If you have undergone this in your pregnancy and you are negative, you also need to take your RhoGAM injection. If unfortunately you had trauma, maybe you had road traffic accident, or maybe you were involved in a fight or in an abusive relationship, any trauma to your midsection, that means any trauma to your belly, to any part of your body that will lead to bleeding inside, can also lead to communication between the baby's blood and your own blood. You need to take your RhoGAM. Now, in some situations during pregnancy, depending on how the baby is presented, we might have a need to flip the baby. So some babies might be breech, and we can try to use a method we call external cephalic version to flip the baby's breech so that the head will present, so there won't be complications. If you had any manipulative process during your pregnancy, you also need to take your RhoGAM. Now, finally, if you had any form of vaginal bleeding in your pregnancy, you are also a candidate for taking the RhoGAM. So all these scenarios I mentioned If you happen to find yourself in any of them, please take your RhoGAM injection. And remember, for all subsequent pregnancies, you are supposed to take the RhoGAM injection. 26 to 28 weeks, within 72 hours of delivery, and if any other thing I mentioned happened. So whether you had that baby, whether you miscarried that baby, whether it's a miscarriage, whether it's a ectopic pregnancy, we need to give you RhoGAM, so to protect you and your baby. Okay, so please make this a point of duty as part of the conversation you will have with your partner before you guys can go advance to say, oh, I'm going to start my family. If we can do this, then we can give our babies a chance of having a very good outcome. Remember to subscribe to this channel if today is the first time of attending the clinic. We normally show up on Tuesdays and Saturdays. Today is actually a special clinic because it's the last day of the year, and I needed to thank you guys for sticking with me. So thank you so much. Make sure you subscribe, share the like button, and just make your comments, ask your questions, and I'll provide you feedbacks. Thank you for being with me in 2021, and please stick with me in 2022. And until I see you in 2022, God bless you and enjoy the rest of your day. Bye-bye for now.